Hello, I'm Secretary of State Kris Warner, and I serve as the Chief Business Officer for the state of West Virginia. Part of my responsibility is to make sure that West Virginia is positioned to help create a strong pro-business environment to help grow our state's economy. To do that, my office is working to promote the services and programs available throughout the state to help support entrepreneurs and small business owners. This is part of a video series we call Just 3 Questions with West Virginia business leaders and entrepreneurs. This week, Just 3 Questions is on the road in Morgantown. Joining me today is David Goldberg, President and CEO of Mon Health System and Executive Vice President of Vandalia Health Northern Region.
Thank you, sir.
Vandalia Health was created in 2022 and is comprised of 17 hospitals across West Virginia, employing more than 13,000 people and serving as economic drivers throughout the state. And this healthcare network is growing. Vandalia Health recently just announced the much anticipated construction of a new hospital at Charles Point Development in Bridgeport. David, thank you very much for joining me for Just 3 Questions.
Thanks for having me. It's great to have you here and back in Morgantown.
Thank you. Let's begin with the nearly $30 million state-of-the-art community hospital that you've designed and are about to break ground in Bridgeport. This construction project in Harrison County will dramatically expand quality and convenient health care to North Central West Virginia. What services will be available at the new hospital, and when do you anticipate the hospital will be open to the public?
Well, thanks for being here in the questions. We broke ground already about a week and a half ago. We don't let any time go by. The Mon Harrison Hospital is very similar to the one we built a few years back in Mon Marion in Whitehall. So it's a 10-bed medical hospital with an 8 ER bay, private room, emergency room. It handles all medical issues a patient would need. You're sitting here right here in Mon Health Medical Center, or as you know, Mon General. And it is the same experience anyone would have on the medical floor. So we can remotely monitor patients to rule out chest pain. They're there dealing with minor medical situations. The emergency room is staffed with 24/7 care by board-certified physicians every hour of the day, every day of the week. And it's an opportunity to provide access to the people of Greater Harrison County to broader care, more timely access to an emergency room. And we're lucky to be able to now be part of the Harrison County community.
I can attest, if you have health, chest pain, this is the place to come. You're a lifesaver. What other expansion projects does Vandalia and Mon Health have underway in West Virginia?
So we announced about $150 million of investment. Actually, today, while you're here with us, David Ramsey, our CEO of Vandalia, is announcing over $35 or $40 million expansion at CAMC's Taze Valley facility. I've mentioned, of course, Mon Harrison. We're expanding our clinic at the Preston Memorial Hospital. We receive lots of grants to do that. We actually announced that we're building a freestanding rehabilitation hospital with a not-for-profit organization called Mary Freebed down in Charleston that will be connected to the CAMC complex. We're expanding a neuroscience institute so people in the South have the same equal access to expansive neurosciences access. We're expanding Greenbrier Hospital with a new medical office building, to name a few. In this building, we're putting a new hybrid room to do interventional cardiac and other procedures in the building, a new electrophysiology lab, and a host of other programs. Down at Stonewall Jackson Memorial Hospital and at Davis Medical Center, we put new CAT scanners that can do what are called CTAs, so we could scan the heart to minimize the person to do an elective cardiac catheterization, so we can keep care close to home and work with the cardiologists and the family medicine doctors at home. Our whole goal is to get the technology and the care close, and that's just the tip of the iceberg of what we have planned going forward.
I love your concept of being able to help people take care of their own health care.
Absolutely.
And $150 million worth of, you're creating your own economic development throughout the whole state.
Absolutely.
It's amazing. Hospitals are a major aspect of economic development and job creation. How do hospitals impact the state's growth and development?
So in most communities, your hospitals are your largest employer. Here, you mentioned earlier, Vandalia Health, with all of our hospitals and people, we're the second largest non-governmental employer in the state. Marshall Health is the 4th largest in the state. And of course, WVU Medicine is the #1 employer in the state. So we employ a lot of people, but I always say our hospitals aren't just the medical providers who deliver that care. We have environmental service workers, we have food service workers, we have accountants, we have information technology people, we have marketing people. You name the position, we hire them, including security. So we're like little cities within ourselves. So we employ people all over our systems, not only to be able to bring economic value back to the locals, we generate payroll tax. We pay tax on every item we buy in and around the area. We might be a not-for-profit and may not pay property tax, but we're paying tax and we're contributing back and we're providing care to those without the ability to pay. So we're a balanced organization and we take that very seriously.
David, thank you very much for joining me for just 3 questions, and thanks for delivering all 5 of my children right here at the hospital.
Excellent.
And you're building a community.
And please have your children who are ready to deliver more, bring them back. We'll deliver them with a smile.
We'll do that. Thank you for joining us today, and we'll see you again next time.